Gastroparesis is a complex and chronic disorder characterized by delayed gastric emptying in the absence of a mechanical obstruction. It affects the normal movement of food from the stomach to the small intestine, leading to symptoms such as nausea, vomiting, early satiety, and abdominal pain. In this script, we will explore the pathophysiology, clinical features, management options, and emerging therapies for gastroparesis. Understanding these aspects of the disease is crucial for healthcare professionals in providing optimal care to patients with gastroparesis. Gastroparesis can be caused by dysfunction in the contractile activity of the stomach, leading to impaired gastric motility. This dysfunction can result from abnormalities in the smooth muscle cells or the neural pathways that control gastric contractions. Additionally, hormonal factors, such as decreased levels of ghrelin and abnormalities in the release of other gut hormones, can contribute to delayed gastric emptying. It is important to understand these underlying mechanisms to guide the development of effective treatment strategies for gastroparesis. Diabetic gastroparesis is a common form of gastroparesis that occurs in individuals with diabetes mellitus. It is believed to result from autonomic neuropathy, where the nerves controlling gastrointestinal function are damaged. The clinical features of diabetic gastroparesis include bloating, postprandial fullness, and erratic glucose control. Management of diabetic gastroparesis involves glycemic control, dietary modifications, prokinetic agents, and consideration of surgical interventions in refractory cases. Several medications have been associated with the development of gastroparesis. These include opioids, anticholinergic agents, calcium channel blockers, and certain psychiatric medications. These medications can affect the smooth muscle contractility of the stomach or disrupt neural signaling. Awareness of the potential impact of these medications on gastric function is essential for healthcare professionals to prevent or manage medication-induced gastroparesis. Surgical interventions may be considered for patients with refractory gastroparesis who have failed conservative management. These interventions include gastric pacemaker placement, pyloroplasty, and gastric bypass. Patient selection for surgery is crucial, and factors such as underlying etiology, severity of symptoms, and response to conservative therapy should be taken into consideration. Understanding the available surgical options and their associated outcomes helps healthcare professionals in guiding patients through the decision-making process. Gastroparesis can significantly impact glycemic control in individuals with diabetes. Delayed gastric emptying can lead to unpredictable absorption of oral glucose-lowering medications, resulting in suboptimal glucose control. Conversely, dysglycemia can further impair gastric motility by affecting the release of gut hormones. Managing the bidirectional relationship between gastroparesis and dysglycemia requires a comprehensive approach involving dietary modifications, medication adjustments, and close monitoring of glucose levels. Gastroparesis is a part of a broader spectrum of gastrointestinal neuromuscular disorders. These disorders include conditions such as chronic intestinal pseudoobstruction, intestinal dysmotility, and enteric neuropathies. Differential diagnosis among these disorders can be challenging, requiring a systematic approach that involves clinical evaluation, radiological imaging, and specialized motility testing. Management strategies vary depending on the specific disorder but often involve a combination of dietary modifications, pharmacotherapy, and surgical interventions. Autonomic neuropathy is a common underlying cause of gastroparesis. It can result from various etiologies, including diabetes, autoimmune diseases, and neurological disorders. Autonomic neuropathy can have significant implications for prognosis and treatment outcomes in gastroparesis. Understanding the specific autonomic dysfunction and its impact on gastric motility helps healthcare professionals in tailoring management strategies to address the underlying neuropathy and improve gastric function. Gastroparesis can have a profound impact on the quality of life of affected individuals. Symptoms such as chronic nausea, vomiting, and dietary restrictions can lead to decreased physical functioning and social isolation. Moreover, the psychological burden of living with a chronic illness and its associated uncertainties can complicate the management of gastroparesis. Support interventions, including patient education, counseling, and support groups, are essential in addressing the holistic needs of patients and promoting their overall well-being. Gastric electrical stimulation, GES, is an emerging modality for the treatment of gastroparesis. GES involves the placement of electrodes in the stomach wall to facilitate gastric motility. The effectiveness of GES in improving symptoms and gastric emptying varies among patients, and understanding the mechanisms behind its action is crucial for appropriate patient selection. Long-term outcomes of GES, including durability of symptom improvement and potential complications, are important considerations when discussing this treatment option with patients. In children, gastroparesis poses distinct diagnostic and treatment challenges. Causes can range from surgical complications to neurological or autoimmune disorders. Comprehensive evaluation of developmental stage, symptoms, and underlying conditions is crucial. Treatment must consider growth and development, requiring collaboration among gastroenterologists, dietitians, and other specialists. Idiopathic gastroparesis, when no known cause is found, is difficult to diagnose due to the need to exclude other causes. Treatment involves dietary changes, medication, and symptom management. Ongoing research aims to improve understanding and develop targeted therapies for this subgroup of patients. The field of gastroparesis research is continuously evolving, with ongoing investigations into new therapeutic modalities. This includes the exploration of novel drugs with prokinetic properties, stem cell-based approaches to regenerate gastric motility, and innovative surgical techniques. Clinical trials evaluating these emerging therapies are underway, providing hope for improved treatment options in the future. Keeping abreast of these advancements is crucial for healthcare professionals in delivering the best possible care to patients with gastroparesis. In conclusion, gastroparesis is a complex disorder with multiple causes and symptoms. Healthcare professionals must stay updated on the latest research and treatment options to provide the best care for patients with gastroparesis, improving their quality of life.